Dental interviews can be really scary because you know that you're competing against the best of the best. So let me give you a competitive edge and watch this video so you can give yourself a better chance. So in this video, I also go through all the possible different interview questions that you could be asked, as well as what each university specifically want. And I also have videos coming out on model answers for these interview questions, as well as advice for MMI and panel interviews. So make sure you subscribe so you don't miss out on any content below. So let's start with something basic, like the different types of interviews that you can get. You can get a panel interview, which is usually you sat across a panel of board of either dental professors, other healthcare professors, dental students, like a mix of like loads of people, and you can get asked questions one-on-one. They can ask you surprise questions, stuff like that. And the other type of interview is an MMI interview, which stands for multiple mini interviews. And basically this is where there are a series of stations and you can be asked to do either ethical scenarios, you can be asked to do traditional questions like why dentistry, you can be asked to do like a task, like a manual dexterity task or like a maths equation. There could even be like an actor and you have to respond to the situation. There are typically around 10 stations and around 5 minutes each, so you're also put under time pressure. The great thing about this is that they're individually assessed by one assessor and it is assessed independently from your other stations. So say you mess up on a station before, they won't know that, so your assessment is purely based on the performance that you do at that one station, and so this could work negatively or positively for you. And to be honest, a lot of universities are progressing towards an MMI style of interview. But to save the hassle, you want to obviously know which universities have which type of interview, and I have two tables up here. I basically go through every single university and I've listed out for you whether it's the panel MMI. So let's talk about why you came here for the interview questions. I've broken these down into subcategories, so questions about dentistry, questions about this university, questions about yourself, and then curveball questions. So let me read them out. So obviously you have the basic questions like why dentistry? Why should we choose you? Why did you choose dentistry and not medicine or nursing? What qualities do you think a dentist has? And then you reflect on like how you have these qualities as well. What about dentists interests you the most and why? How does teamwork apply to dentistry? In your work experience, what skills have you learnt? And how does this apply to dentistry? During your work experience, can you tell us about a difficult situation you have dealt with and what you learnt from it? And especially in a panel interview, they can sometimes have your personal statement in front of you, so they can pick up on specific work experiences and ask you to tell you more about them. So especially if you lied on your personal statement, you better know everything on your personal statement inside out for your interview. But yeah, what are the negative aspects of dentistry? Tell me about something you have recently researched or read upon dentistry related. What can you tell us about modern advances in dentistry? How do you think dentistry has been impacted by COVID-19? Probably a very likely question, especially, you know, because we're so new to everything right now. Tell me about X. So this could be things like fluoride debate, the amalgam debate, dentistry and COVID, NHS and private dentistry, and whether it should be private or public. You can also have questions on ethical scenarios. So say you smell alcohol on a co-worker's breath, but you're not sure it's alcohol. So what would you do in this situation, and who do you go to if you go to anyone at all? I have a whole video going into more depth about how to answer these ethical scenarios and what you need to know, things like ethical pillars and the GDC principles, but also exactly how to answer these questions. So make sure you don't miss out on this and subscribe down below so you can catch that video. But yeah, what would you do if your patient doesn't believe in X, like flossing, fluoride, etc.? How would you break bad news to a patient? And this is likely going to be in a scenario or with an actor or something like that. And then the next question, if you had your own dental practice, what would you most likely organize differently and why? And then we can move on to questions about this university. What interests you most about our course? When you read our prospectus, what interested you most about the course here? You can talk about like when they start clinics, what their facilities are like, or the way that they teach. Like, is it spiral learning, or like what is the system set up like? It's really helpful to also just ask people that already go to this university. So if you know someone that's gone into whichever university you're applying to, it's really, really helpful to ask them, okay, how is this university like? What's the campus like? What's the structure of learning? How early do you get to see patients? Stuff like that. I think it's also useful to have like their university motto or slogan and know those things, like the roots of the university, because you can always pull these things up in interviews and it's really just like it shows that you're really committed or passionate about this university. And then we have questions about yourself. So my first one here is, tell me more about X. and this can be something that you wrote about in your personal statement or something that you talked about before. What are your strengths and weaknesses? Tell us about your extracurricular activities. Stress management, how do you manage stress? Give us an example of where you had to manage stress and successfully managed it. Leadership roles, so when have you demonstrated leadership skills? What makes you a good leader? What do you think makes up a good leader? And then you have tell us about a group activity you have organized. What went well? What went badly? What did you learn from it? How will you deal with a personal matter in a workplace? Can you give us an example of how you coped with a conflict with a colleague or a friend? And then you can also get curveball questions. And like, I didn't expect this, but I actually got these in my interview. Like, I swear to God, like I didn't even expect to be asked these random questions, and it was so like out of the blue. They're like, why dentistry? And then they're like, okay, what does this painting mean behind you? And I was like, but yeah, you just kind of have to bluff it. I've talked a lot about how, you know, bring in the GDC principles of the good dentist and stuff like that, or just talk about emotion. Really just waffle. You have to waffle. And another question they asked me, which was so random, was, you know, say someone really close to you passed away. How do you think that would impact the relationships in your family? Like, I can kind of get it, but it's nothing to do with me. It's to do with my family, and it's nothing to do with dentistry. But yeah, those are really weird questions that I got. So, example questions. Now, with any of these answers, I can tell you that number one thing is confidence is key. The way that you come across and the way that you can waffle on the spot and the way that you articulate yourself is so important. The way that you walk into a room. And interviews are really an interaction. You know, the way that you give that impression is so important. And I'll talk more about what you can wear as well later on, but practice, 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 get that confidence, you know, leave the stress and the doubt at the door. So I've talked about this in some of my other videos, and that is for each thing that you talk about on your personal statement, so each like work experience, situation, or, you know, experience that you had basically that shaped you into who you are today and all that stuff, have a story behind it. So if they ask you about your work experience at a care home, you will have a story already ready to talk about, and you can, and these stories can not only be used in this context, but say they ask you, okay, like, what do you think makes a good leader, and how do you think you've gained those qualities? You can be like, okay, so like, you know, during my time at a care home, I learned XXX, and, you know, I came to realize the importance of leadership, and, you know, I've put this into like motion to make me a better leader and all stuff like that. It's kind of really basic, but, you know, having these stories in your head means that you can elaborate so much more. You can't just, it's way better than just being like, I think a good leader is XXX, and I've done this because, you know, it's way better than that because you're drawing from actual experiences and they know about it. And you're also kind of like showing them, like, yeah, I did work experience, as well as I have the leadership skills. So yeah, I think long story short, like, and also just make sure that you reflect on everything. Like, you know, it's all well and done saying I did, you know, a whole list of achievements, but, you know, not reflecting on any of them. It's all about the qualities of a dentist and the qualities that you have that will get you the interview, basically. Now, it's kind of a cheat because I'm not going to be talking about example answers here. I actually have specific videos on, you know, why dentistry, and, you know, why should you choose me, and, you know, why dentistry, not medicine. So it's kind of just like redundant, and this video would be so long if I talked about each of these questions in tandem. So make sure you check out those videos. But yeah, so subscribe. So how do you prepare for your interviews? Now, I've kind of talked about this before, but make sure you know your personal statement inside out. Make sure you have like experiences that you can draw upon, things that made you a leader, things that, you know, you brought from this work experience like I literally just talked about. So have those on hand. Make sure that you have these things in like bullet point form, so you're not memorizing them outright, because memorizing you're gonna choke up and stuff like that. You just have them that you can like talk on them and bring and reflect more on them if need be. They're just there so that you can pull on them. Say they ask you a question on the spot, you're not going to be struggling because you'll have things that you can pull on that you've already prepared in advance. There's also other things that you need to know, like the ethical pillars, you know, the GDC principles of a good dentist. You also need to be up to date on the dentistry news, so things like how is COVID impacting dentistry, the amalgam debate, fluoride debate, things that are relevant to dentistry. Like I talked about before, like reading the BDJ, that's really helpful. Browsing on these nature websites, I know that Nature has like a really good section on relevant news to dentistry, and that's really helpful. You also want to give yourself enough time to prepare, because you don't want to feel like you're cramming it in at the last moment. You know, it's all about practice, it's all about confidence. You know, you get confidence through practicing, doing all these mock interviews, doing all of like, you know, practicing with people, practicing in the mirror, practicing in the shower. You want to have enough time to know that you've researched enough and that you've got all of this practice under the belt. You want to focus on being confident and really work on that skill, because that is the most important factor in your interview. You also want to give yourself as much practice as you can. So ask anyone that is willing to do it for you. Family members, professors, you can get people online that do it for you. You can look in the mirror and press record on your phone and listen back to it as well to see how your answers were. Did you stumble? How was your voice sounding? All of that stuff. Get prepared. So have a list of questions that you know that you're going to practice beforehand. Have bullet points of things that you would answer with. Don't write it out word for word, because like I said before, memorization is not the way to do this. You'll choke up, you'll forget one word or two, and then you'll be stuck because you're like, oh my god, I can't remember that one word that was in the middle of the sentence. And when that's not the important part. The important part is I drew from this experience and can see I'm a leader because of XYZ, all of that stuff. The thing is with interviews, you can be given an interview at any point. They could be giving you early interviews, they can be giving you late interviews. So really what you want to do is you want to have your clothes and everything ready, because they might tell you have an interview and then you only have 2 weeks to get your clothes ready. And the thing is, like with the coronavirus and everything like that, you're most likely not going to be able to go in store and try on these clothes and stuff like that. So I'm going to go over each university and I'll talk about specifically what is likely to come up on their interviews based on things that have been said online, based on students that are currently at those universities and what they remember from their interviews. But there is a really good website called MedicMind, and they have like really good resources on, like, I think there's like a university like comparer, and it talks about so much information about each university and their interview process and stuff like that, and it's really like worth going and looking at. I really wish something like this was there when I was applying, but I know that they have like private tutoring and stuff like that. I've never tried those kind of things, but I do know that their free resources are really good. If you have the extra cash, I don't see why not, like, you know, trying those private tutoring and mock interviews and stuff like that. But yeah, let's move on to manual dexterity. A lot of people bring things in, and I don't think it's necessary, but I do think that it's a very good thing to bring in, because it really shows that you know what the career is about. And manual dexterity is a very big part of it, because you're going to be in maths all day long, and you know, you're working within a very small parameter. Like some people have very small mouths and very big tongues and stuff like that. So, you know, having that manual dexterity, working on the small teeth, that really shows that you know what the career is about, you know what's expected of you, and bringing something in knows that you've been working on these skills. So I have an entire video that is all about like manual dexterity and very cool, unique things that I've not seen elsewhere. I think it's probably one of like my most favorite videos, because I found such like niche things that I've never seen before, and I don't know anyone that's put these things in, so you could be unique in bringing these things in. But like, you know, for example, there's like suture pads and stuff like that, so you can show that you can do sutures, and maybe watch one video or two on YouTube to show you how to do that. But you know, suturing is something that you do have to do in dentistry. When you have a extraction socket and you have to like sew it up with like a horizontal mattress suture, or if you have minor oral surgery, which you are qualified to do as a clinician, you would have to like sew the gum flap up and stuff like that. So those are things that you do need to know. There are other things like Cryodent, which is like these little polymer beads that you are supposed to shape into the shape of your tooth for people that don't have teeth or don't have access to a dentist at the moment and want to replace their missing gaps, like their gaps in their mouth, stuff like that. And then like actual like teeth composite kits, so many other things that I think are just so really cool, and I think you should watch that video and check out my channel, because I have so many other things like that as well. But yeah, I don't think it's something that you need to bring in. I do think it's something that you should bring in. So other things that you need to know that are really important is, one, make sure that you're there on time. So I know lots of people that go there on the day and then come back on the day, so that's kind of risky but fair if that's all you can do. But it's kind of also stressful, because it's a long commute, then you'd be going there for 4 hours, and then you get there just in time. What if there's traffic, all of that stuff, and you want to make sure that you know you have a map. You want to know where it is, you want to get there early, because it's so easy to get lost in a place that you've never been before. Parking's a mess and stuff like that. So just get there really early, like really early, and know where it is, go there early, literally just like sit outside, prepare yourself, like be calm, all of that stuff, if you have the time. That is so key. The next thing is to be aware of your body language, the way that you walk into the room, the way that you're slouching, so don't slouch, the way that you present yourself, kind of like shake hands if the situation calls for it, the way that you sit, you know, eye contact, all of that. Don't be constantly looking away. Like, you need to have that person-to-person interaction. You need to have those people skills, because that is a very big part of being a dentist as well. Sometimes they'll ask you at the end of an interview, like, oh, do you have any questions? So you can prepare some interview questions that will hopefully help you. Obviously, if you don't have a lot of time before your interview and you didn't think you were going to get an interview or something like that, then focus on the like core questions like why dentistry? More likely than not, look, most of universities use those questions. But also, even if they don't, you have things like bullet points answers that you can translate into other questions. So, you know, what are your strengths or something like that, and you can kind of pull from the different questions that you've already prepared for and kind of have something to say about that. And like I said before, you know, having these like memories of like work experience and like reflections on that and being able to pull from that as well, that's also key, because I just found that so helpful. And then if I was also running out of time, I would then at that point focus on specific university research, because it's very easy to tell when you just go to the university interview because, you know, it's an extra interview and it's interview practice or whatever, and you've already gotten your place. Like, you really want to make sure that you show that you're committed to this place, that you really want to go, and you know, you really want to get the offer. So yeah, just do the research. And the main thing is figure out what their course is like, when their clinical activity starts. So, you know, when are you seeing patients and stuff like that. Really figure out those kind of things and what the university stands for, and that will get you far in the interview. And then make sure that you also know all of the basic stuff like fluoride debate, the amalgam debate, all of these things, like, and obviously COVID and dentistry, that's going to be like a really big one. But yeah, make sure you know these things because they will come up, and you don't want to be like a fool and, you know, answer everything else and waffle through it. And these things you can't waffle through because, like, you know, it's actually about news and stuff like that. So yeah, just do your research. But yeah, I hope this was really helpful. I have specific videos coming out on the different interview questions, like why dentistry and model answers for that. So make sure you subscribe so you don't miss out. And I have so many more videos that are coming out all around helping you get into dentistry. So yeah, check out these other 2 videos over here, and I will see you soon. Bye.